Hello and welcome to Askimo TV. I'm talking today to Dr. Robert Greenbaum. Dr. Greenbaum is a senior cardiologist working in London at the Royal Free, Barnet and Wellington hospitals. He is a past president of the cardiology section of the Royal Society of Medicine. He treats the full range of adult cardiology and has a particular interest in coronary angioplasty and implantation of pacemakers. Hi, Dr. Greenbaum. How are you?
Good morning. I'm fine. Thank you.
Dr. Greenbaum, today's discussion is going to be about controlling your blood pressure and cholesterol and things you can do to reduce your risk of a heart attack. So what is cholesterol?
Cholesterol is a fatty substance found inside the blood. All of us have it. The levels will vary. Some of it comes from the diet, but actually most of it is made within the liver. And so although diet does have some importance, a lot of your circulating cholesterol, probably around 80%, you actually make yourself.
What is meant by high blood cholesterol?
Well, international committees of scientists and cardiologists have got together and looked at the risk people have of developing strokes, heart attack, and angina. And it was an observation made many years ago that patients or individuals with high levels of cholesterol are at greater risk. And over the years, there's been detailed studies, and the message is the higher your cholesterol, then the greater your risk over 5, 10, 15 years of developing these problems.
What should a good cholesterol and blood pressure level be, and if there's any differences for men and women?
Well, the short answer is within limits, the lower the better. And certainly that's true for cholesterol. If you look at rural populations in China, they have very low cholesterols, unimagined in the West. And equally, they have very little in the way of coronary heart disease and strokes. The levels have changed over time as the evidence has improved. Ideally, if you're measuring it in European units, your cholesterol level as an ideal should be less than 4. In units used in other countries, that equates to around about 160.
Tell me, what are the main causes for high cholesterol and blood pressure?
Well, if in terms of cholesterol, there's a very small group of patients who've inherited genes which lead to high cholesterol, but that's not the common. For most of us, it's probably related to the diet that we've eaten through from childhood. But remember, most of your cholesterol is what you make inside you, and it's possibly through eating poorer diets over the years that we actually make too much cholesterol.
And in terms of blood pressure, high blood pressure, what would those main causes be?
Well, there's a Nobel Prize going, I think, for anybody who finds the cause. Although it's common and we can treat it, we actually, in the vast majority of cases, probably over 95% of cases, don't know is the answer. There are rare causes. There are rare hormone abnormalities which account for less than 5% of cases. And the other factor in young women are some forms of the oral contraceptive pill. That can cause high blood pressure, or at least if you have a tendency towards it, will bring it out.
So I guess the all-important question is, what can people do to make sure that they keep their blood pressure and cholesterol at a good level, thereby lowering the risk of heart attacks?
Well, for otherwise healthy people, leading a healthy lifestyle, the sort of thing that doctors often recommend, which is keeping your weight down, taking a bit more exercise, avoiding excessive salt in the diet, not smoking. So all these things go together, but there will be people, in spite of leading these lives, who do require medication.
Thank you, Dr. Greenbaum. Thank you so much for talking to me today.
My pleasure.